My name is Dr. David Maina Mungai. I'm a doctor by training and a TB survivor and a TB advocate for that matter. In the initial moment when you're given this diagnosis and you are told this is what you have and this is the process, most patients want to retreat and think about it. How will I manage? Okay. For my story, I didn't come out to be a champion until almost 9 years later. Actually, I never wanted people to know that I ever suffered from TB. Because now I'm well, I'm looking well and healthy. But now I discovered by keeping quiet, I'm not helping it. Having been a medical student and now a medical worker, healthcare worker, doctor who suffered from TB, if I can come out and voice and add to these voices, then it is helpful. So privacy. In the initial stage, yes, but as they finish and as they deal with the demons associated with this, you find out it will reach a point where you'll be comfortable and you're able to come out and speak. People will be more courageous and confident to come out and talk about TB. If former TB patients who are healthcare workers can form a sort of a group, a support group, where we can speak and encourage one another. So for example, for me now that I've come out to speak, there's somebody else who's still afraid. In such a group, I'll encourage them and tell them, look here, this is what will happen. And by you coming out, you will be encouraging more and more people. And people will even be more confident knowing that, look here, even the healthcare workers are suffering this and they get healed and they continue normal life. So at the end of the day, a TB diagnosis is not like a death sentence or condemnation. And that will be a very strong voice. One of the challenges, like where I've practiced, is that we don't have like a one-stop kind of process. So one of the advocacy we've been advocating for is to have like centers of excellence where these TB patients can have a one-stop thing. If it's an X-ray needed, you'll get it reported and all that. If it's the sputum microbiology, it's examined. If the gene expert, like that. So one of the things is that most of the treatment places are within the government facilities. So we need to enhance this even to the private, mission hospital and even private facilities, even private clinics. The drugs also are quite strong, working on your liver and kidneys, so they need very nice nutritional support. And so if this can be extended to the community, then this will be very helpful in helping TB treatment. TB symptoms mostly, we talk about a cough, and this cough should be like a chronic one that has lasted more than 2 weeks, but if it's not even more than 2 weeks, but you see blood in your cough, whatever is coming out when you cough is bloody, or it's rusty, looking darkish brown like that, that's a worrisome symptom that might allude to TB. Chest pains, chest pains. Then you have night sweats. You tend to sweat a lot at night. Hotness of body may or may not be there usually, but night sweats is an important sign. Then wasting. So a person who's healthy, let's say, suddenly an intentional loss of weight significantly, say more than 10%, then you suspect of TB. These ones are for the TB of the lungs. Now I must add that we tend to get TB outside the lungs, and the main system is like the lymphatic system. So you have swelling of the neck that cannot be explained, or swelling of the groin region, then you must suspect of TB. TB being a bacterial illness, indeed it has a treatment in terms of antibiotics that work. TB is curable. I've been cured for more than 10 years now, living a healthy, normal life. So indeed, when you get diagnosis of TB and you are started on treatment, it's good that you be compliant on your treatment, take your medication religiously, and for sure your TB will be cured completely. TB is preventable, TB is curable, TB in a TB.